Welcome to part 4, chapter 42. Let's talk about corneal disorders. For a sharp retinal image, the cornea must be transparent and intact. Corneal problems might be caused by inflammation of the cornea, which is called keratitis, degeneration of the cornea, keratoconus, or deposits in the cornea. All corneal problems reduce visual sensory perception, and some can lead to blindness. Now, corneal abrasion, ulceration, and infection. A corneal abrasion is a scrape or a scratch injury in the cornea. This painful condition can be caused by a small foreign body, trauma, contact lens, as we mentioned before, malnutrition, dry eye syndromes, or certain cancer therapies. The abrasion allows organisms to enter, leading to corneal infection, bacterial, protozoal, and fungal infections can lead to corneal ulceration, a deeper injury. This problem is an emergency because the cornea has to separate blood supply and infections. The cornea has no separate blood supply, and infection that can permanently impair vision develop rapidly. So the patient with a corneal disorder has pain, of course, reduced vision, of course, photophobia, and eye secretions. Cloudy or purulent fluid may be present on the eyelids or eyelashes. So when fluorescent stain is used, the patchy area appears green. Corneal scraping done by the eye care provider after anesthetizing the cornea with a topical agent and microbial cultures are used to determine the causative organism. For culture, obtain swabs from the ulcer and its ages. What is the intervention? Anti-infective therapy is started before the organism is identified because of the high risk for vision loss. So before the organism is identified, antibiotics are going to be, or any other type of medication is going to be received. A broad spectrum antibiotic is prescribed first and may be changed when cultural resources are known. So a broad antibiotic, a broad spectrum antibiotic is going to be prescribed, and then based on the organism, they are going to correct that prescription, and it's going to be more specialized for that organism. Steroids may be used with antibiotics to reduce the eye inflammation, of course, and this is good to know. All this information about the antibiotic and the steroids is good to know. Often the anti-effective therapy involves instilling eye drops every hour for the first 24 hours. It's every hour, okay? 24 times. Teach the patient or family member how to instill the eye drops correctly. If the eye infection occurs only in one eye, teach the patient not to use the drug in the unaffected eye. Okay? As I mentioned in part 1, I think, or part 2. You never share your eye drops. Never. Nursing safety priority. Action alert. Teach the importance of applying the drug as often as prescribed, even at night, and to complete the entire course of that antibiotic therapy. Treating the infection can save the vision in the infected eye. Teach patient to avoid using makeup around the eye until the infection has cleared. I know teenagers are going to have a hard time following these instructions, but you have to let them know, is this or probably vision loss? Another nursing safety priority, check the route for administration of ophthalmic drugs. Most are administered by the eye installation route, not orally. Administering these drugs orally can cause systemic side effects and will not therapeutically treat the eye condition. Be sure to reinforce the correct route when teaching the patient. Now let's go for keratoconus. This is another problem in the cornea. Keratoconus is the degeneration of corneal tissue resulting in abnormal corneal shape. Can occur with trauma or maybe inherited disorder. Inadequately treated corneal infection and severe trauma can scar the cornea and lead to severe visual impairment that can be improved only by surgical intervention. So you can see here the shapes, the normal and the keratoconus. Okay, so keratoplasty is the corneal transplant. It's a surgical procedure to improve clarity for a permanent corneal disorder that obscures the vision. The diseased corneal tissue is removed. This is very serious intervention and replaced with tissue from a cornea donated by a human who has passed away. This is a serious condition. Local antibiotics are injected or instilled. Usually the eye is covered with a pressure patch and a protective shield until the patient returns to the surgeon. Instruct the patient to lie on the non-operative side to reduce intraocular pressure. If a patch is to be used for more than a day, teach application processes. Instruct the patient to wear the shield at night for the first month after surgery and whenever around small children or pets to avoid injury. Instruct him or her not to use an ice pack on the eye. Complications after surgery include bleeding, wound leakage, infection, and graft rejection. Of course, this is a transplant, right? We have to take all measures. The eye should be protected from any activity that can increase the pressure on, around, or inside the eye. Teach the patient to avoid jogging, running, dancing, and any other activity that promotes rapid or jerky head motions for several weeks after surgery. I want to mention something and give you an example. I have a very close friend who is a voiceover from a TV channel in Peru. He went through this surgery, and in order to avoid pressure in his eyes, he had to stop working because his work is basically being a voiceover, right? He receives all the text to be recorded to make the promotion for the soap operas, for the programs. So his life is basically inside like a radio cabinet, and he's just recording. But the level of intensity in his voice, the way he pronounces this text, is increasing the pressure. So he had to stop for 6 months. I think he went over 8 months not to record in order to prevent the pressure in the cranial cavity in the whole head has to be relaxed. He cannot scream, he cannot elevate his voice. Is serious. If a deceased patient is non-eye donor, follow this recommended step prior to donation. And especially we have to, all nurses that are going to work in a hospice, you need to follow these protocols. Is very important, right? Because some organs are going to be very, very important for other people in order to save their lives. So you need to pay attention to this. Raise the head of the bed 30 degrees, instill prescribed antibiotic eye drops, close the eyes, and apply a small eye pack. Okay. And these are like very basic, only this is related to the cornea. There are other protocols for donating, your kidneys, donating your liver, other protocols. Okay. Retinal disorders. Macular degeneration, also known as age-related macular degeneration, AMD, is the deterioration of the macula, the area of central vision, and can be age-related or exudative. There are two types of age-related macular degeneration, dry and wet. Dry AMD is a more common type of this condition. It is caused by a slow and gradual blockage of retinal capillaries by pigmented residue and photoreceptor waste products in the retina, allowing retinal cells in the macula to become ischemic and necrotic. Central vision declines, and patients describe mild burning and distortion at first. Mild burning and distortion at first. That's a very specific signs and symptoms, okay? Night vision is impacted, and the ability to see clearly when reading is impaired. Eventually, the patient loses all central vision. So the glaucoma is peripheral vision. Here in retinal, we have central vision loss. Dry AMA progresses at a faster rate among smokers than among non-smokers. In general, smoking is affecting, all these disorders. But in this macular degeneration, the smokers are the most affected. Individuals with diabetes, hypertension, and high cholesterol are at high risk for developing this condition. Also pay attention to the family history of AMD. Wet exudative AMD progresses quickly. Patients experience a sudden decrease in vision after a detachment of pigment epithelium in the macula. Newly formed blood vessels, which have very thin walls, invade the injury area and cause fluid and blood to collect under the macula like a blister, with scar formation and visual distortion. That's why it's called the wet, because there is new blood vessels that are going to invade this area, and it's going to be fluid and blood to be collected under the macula. That's the wet concept, fluid and blood. Okay, so assessment, recognizing the clues. IV fluorescent angiography may be performed by the eye care provider to locate leaking vessels. An Amsler grid test may be conducted to demonstrate central visual field loss. And let's see the Amsler grid testing. How is this done so we can understand this disorder better?
Amsler grid testing examines the central 20 degrees of the visual field. The patient is instructed to look at the black dot in the center of the grid. The patient should wear their glasses. Any irregularities in the straight lines around the grid are noted by the patient. Each eye should be tested individually. Irregularities would include waviness of the lines, gray or fuzzy lines, or absent areas on the grid.
Thank you so much. So this is a test that in which the area to be tested is smaller. You see the small hole in that black kind of glasses, right? Metal glasses. The glaucoma is like a capsule. You put your hand inside of a capsule and you need to see this big area where different dots are going to appear in the middle, in the outside, and the peripheral area. Okay. Okay, let's continue. The dry AMD has no cure. Management in the community setting is focused on allowing the progression of the vision loss and helping the patient maximize remaining vision and quality of life. The risk for dry AMD can be reduced by increasing long-term dietary intake of the carotenoids lutein and zeaxanthin. Okay, so lutein, look at this number of foods that contains this lutein, this ingredient. You have your egg yolks, the most really absorbed source of the fat content. You have basil, parsley, your dark leafy greens, vegetables such as spinach, kale, broccoli, lettuce. Yellow corn kale is particularly high in lutein with 6447 micrograms of lutein per cooked cup. Egg yolks and the corn are yellow, and you have your green, all dark greens, right? The zeaxanthin, you have your eggs, your oranges, your grapes, corn, and goji berries. The goji berries are well known lady. They are the superstars berries of this group of berries. Between the berries, strawberries, blackberries, the blueberries, and all the berries, the cranberries, The goji berries are the star. They are very healthy and they are antioxidant. They have antioxidant properties and they are miraculous, the goji berries, okay? So what I wanted to highlight here is that we spoke about the Christmas color to prevent eye disorders, our red, orange, and green, okay? If we want to prevent these macular diseases, we can add yellow. That's it. You add the yellow, okay? Your egg yolks, your corn, you know, is very important. The grapes would be the only exception, but you have red grapes, you have purple grapes, you have the green grapes, and basically all your red, dark greens, and the yellow. Focus on that, okay, to prevent these eye conditions. um Central vision loss reduces the ability to read, write, recognize safety hazards, or drive. Exactly. Suggest alternative, large print books, public transportation, and refer to community resources that provide adaptive equipment. Laser tape therapy to seal the leakage of blood vessels can limit the extent of the damage. Okay, pay attention to your NCLEX questions. Let's go to retinal holes, tears, and detachments. A retinal hole is a break in the retina caused by trauma or that occurs with agents. A retinal laser is a jagged or irregularity shaped break in the retina which can result from tractions on the retina. A retinal detachment is the separation of the retina from the epithelium. Detachments are classified by the type and cause of their development. Also, you have the onset of a retinal detachment is usually sudden and painless. That's scary. The retina is sudden and painless. Patient may report suddenly seeing bright flashes of light, photopsia, or floating dark spots in the affected eye. That's the retina. Okay? Um, Treatments involves creating a scar with laser photoangulation or a freezing probe that will bind the retina and choroid together around the break. A spontaneous reattachment of a totally detached retina is rare. Surgical repair, called scleral buckling, is needed to replace the retina in contact with the underlying structures. So when somebody is telling you, I see floaters, I see flashing lights, that's immediately you need to go to the doctor to check for retinal, okay, and the cornea. Surgery is performed with the patient under general anesthesia. In scleral buckling, the eye surgeon repairs wrinkles or folds in the retina and indents the eye surface to relieve the tugging pressure of the retina. Teach the signs and symptoms of infection and detachment, sudden reduced visual acuity, eye pain, pupil that does not constrict in response to light, and to notify the surgeon immediately of this if these symptoms occurs. And that's good to know. It's good to know to identify the signs and symptoms of infection and detachment, like sudden reduced visual acuity, eye pain, pupil that does not constrict in response to light. Remember, when you put a lot of light in front of the pupil should constrict. If you remove that light, the pupil must be dilated, okay? And to notify the surgeon immediately if these symptoms occur. Refractive errors. The ability of the eye to focus images on the retina depends on the length of the eye from front to back and the refractive power of the lens system. Refraction is the bending of light rays. Problems in either eye length or refraction can result in refractive error. And we know the myopia is the nearsightedness in which the eye over refracts the light and the bent images fall in front of none of the retina. Hyperopia, also called hypermetropia or farsightedness, farsightedness, in which reaction is too weak bear with me, guys. I'm kind of tired. Causing images to be focused behind the retina. Presbyopia is the age-related problem in which the lens loses its elasticity and is less able to change shape to focus the eye for close work. As a result, images fall behind the retina. This problem usually begins in adults in their 40s. Astigmatism occurs when the curve of the cornea is uneven because light rays are not refracted equally in all directions. The image does not focus on the retina. We spoke about this in the first part of chapter 42. Refractive errors are corrected with eyeglasses or contact lens. Myopic vision is corrected with a concave lens that moves the image back to the retina. Surgery can correct some refractive errors and enhance vision. The most common vision enhancing surgery is laser in situ. Keratomileusis is called LASIK. Okay. This procedure can correct nearsightedness, farsightedness, and astigmatism. Yes, I can give faith of that. I can give true testimony of that. Trauma for the eye or orbital area can result from almost any activity. Care varies depending on the area of the eye affected, whether the glove of the eye has been penetrated, and the mechanism of trauma. Foreign bodies, if an eye if an eye dressing or patch is applied after the foreign body is removed, tell the patient how long this must be in place. Follow up as directed by the eye care provider is needed to confirm that appropriate healing is taking place. Lacerations. Lacerations are caused by sharp objects and projectiles. The injury occurs more commonly to the eyelids and cornea. Although any part of the eye can be lacerated, the patient with a laceration should receive medical attention right away. Corneal lacerations are an emergency because eye contacts may prolapse through the laceration. Sharp objects and projectiles. So now that we are close to holidays, and we love to have our champagne and our sparkling wine, be careful when you open those bottles, okay? Because you can have problems when you open your bottle of wine. The cork can come directly to your eye, or maybe the glass of the bottle is already broken. So when the cork comes out, you can get a piece of glass in your eye. I had that experience with that with a family member during New Year's party like 30 years ago. I know what is that. So be careful. Put a napkin or a towel to cover the cork when you are removing it or you are opening your bottle of champagne or wine or whatever it is. Best practice for patient safety and quality care: ocular irrigation is something that we need to consider. And here is the list of how this irrigation is done. Penetrating injuries. A penetrating injury often leads to permanent loss of visual sensory perception. Glass, high-speed metal, or wood particles, BB pellets, and bullets are common causes of penetrating injuries. The particles can enter the eye and lodge in or behind the eyeball. X-ray and CT scans of the orbits are usually performed. MRI is contraindicated because the procedure may move any metal containing projectile and cause more injury. So that's some considerations that we need to have now that we are in holidays. An object protruding from an eye is removed only by an eye care provider. And this is very important. Very important. Do not touch a patient that has an object in the eye. This must be removed by a provider. They have specific tools. They have a specific lens that will allow them to see the diameter of the object, how much tissue is involved, what part of the tissue. So you don't touch that because it may be holding the eye structures in place. Improper removal can cause structure to prolapse out of the eye, and it can cause vision loss. Okay, guys, so this is the end of chapter 42. It was a very long chapter with too many different diseases, conditions, disorders. The most important are cataracts and glaucoma. The other ones are basically you need to protect yourself to get into these conditions and avoid risky activities to prevent lacerations, foreign bodies, and all these conditions. Okay, so thank you for attending.